The delivery of care model here in the US for the past 20, 30 years was very much focused on inpatient care. And it was all centered around the hospital. And it was all about taking care of patients after they're already very sick. And I think what's happened more recently, we've come to the realization that that's not the most effective way to take care of our patients, to take care of our people, and to manage our health system. So we've evolved into a model that's much more focused on the outpatient ambulatory care arena. Further, we're much more focused on the patient. And for those of us that aren't or haven't gotten there yet, we need to get there quickly. And finally, it's all about prevention and wellness. So it's about taking care of the individuals earlier, making sure as you see signs of the very chronic diseases or the more acute sicknesses, you're ahead of the curve so you're able to manage it better. It's more cost effective, it's better for the patient, so on and so forth. So because of the model changing, what we're seeing in the environment itself is changes in many different areas. So regulation change, payer or insurance change, changes with the competition. The technology, of course, is a mainstay and growing rapidly. And then just how the hospitals and health systems are proceeding. So we're going to touch a little bit on all these areas before we talk a bit more about the business and the impact and the trends evolving due to these changes. So we've talked about all these areas, and really in a nutshell, what's happening is we've created a new world of medicine. And back to what I was talking about, plan A or plan B, if we have our plan A and we just stick to our plan A without adjusting or modifying to a better plan, I'm concerned that as practitioners, it's not going to work. It's not going to be viable because the new world's about patient focus. It's about prevention and wellness. It's increased consumerism, as I mentioned, and it's much more about coordination of care. And those of you that are able to coordinate more effectively with all these different players, the more successful you probably will be in this new world of medicine.